Hey guys, I know it's been a while. I just got, hopefully, a better picture on my new phone that I just got. And also, I wanted to let y'all know that I got internet. So hopefully that uploads right. It's going to be my first video with that. And I wanted to tell you guys that I finally got my test back that I have been waiting for on my Recurrent Miscarriage Panel. So if you're struggling with miscarriages, recurrent miscarriages, maybe these are some of the tests that you can ask your doctor about. I'm not a doctor, I'm not a nurse. These are just simply suggestions that you can use at your own will. So I'm just going to be going over my results, some of the tests that he ordered. I think there's 18, I want to say, and so we'll just go ahead and start. So I had a TSH, which is like the thyroid panel. That's just the regular one. Now, I want to go ahead and say there's other thyroid tests. You could have a normal thyroid TSH, but have other thyroid issues with some of the other advanced tests, if that makes sense. But my TSH was 1.6. The range for that was 0.3 to 4.9, so that was okay. My AMH level, which is like how they kind of calculate at the fertility clinic how many follicles or eggs that you don't want to say you'll get all those eggs whenever you stimulate, but it's just it gives them kind of an estimate, if you will. Anyway, my AMH is 7.35. The range is 1.02 to 14.63, so I'm in the middle. Anyway, people with PCOS tend to have a higher AMH, so if yours is kind of on the lower side, but it's still in that range, don't freak out. It's just people with my condition tend to have a higher level. So we tend to have more eggs. They're just not as good as quality as someone else's may normally be. And then he also tested me for prolactin. My range was 14.7. The overall range is 5.2 to 26.5. So I was a little under the middle in that, and that was fine. And of course, just like at your regular doctor, my doctor ran a CBC panel, and there's many tests within that. That's just a typical CBC panel, and all those were pretty much okay on that. And I think I've talked to y'all about the antibody test before. I had went to see a second doctor to see what he thought, and then I told my clinic about what they said, and they kind of agreed on some things. But my thyroglobulin antibody test, it was positive at first, and then I took it again and it was negative. One doctor I see may mention I could have like an antibody issue where like they go up and down, like when you're in the middle of like a antibody or like an autoimmune stage, you could have like a flare-up and it be higher than normal and then it go back negative. So that's that one. And then I had a Cardiolipin antibody test. Please look into this if you're having recurrent miscarriages, or ask your doctor what they think. You sometimes have to really advocate to get these tests, because I know in some places and some doctors, they don't like to test you for the recurrent miscarriage panel unless you've had like 4 or more miscarriages, and that's really sad because you could just simply order these tests for your patients, although they are expensive. But if you're having recurrent miscarriages, your doctor could possibly, I'm not a doctor, but I'm just saying, for me, they coded it to where it would cover because it was considered like a medical issue condition. So my insurance paid for these tests. So anyway, I did test positive for the Cardiolipin antibody, and what I've been explained to that it is essentially, it's like having thicker blood, like your blood could possibly clot whenever you're pregnant. That's not good because it could create like knots in the umbilical cord area, and your baby could like not get its nutrients that it needs, or it could hurt like brain development, heart development, issues like that, and it can cause recurrent miscarriages. So this was a big deal for me to find this out, and this is the test that I have been waiting for. I've always felt like I had another underlying issue than just being told I'm having a chemical pregnancy. I know doctors like to say a lot like, I'm not sure, it's just a chemical pregnancy, but I've had 2 miscarriages, and then so I was like, I really don't feel like this time it's a chemical, you know, because I don't know, just the protocol I was on, it should have worked. I mean, my HCG levels were good on my first draw, and I think once I just get to like in between the 6 or 7 week mark, something's wrong, and that could be it, that it's like making me miscarry because my baby's not getting the development it needs or the nutrients it needs. So Cardiolipin antibody, you should ask your doctor about that. I got this test done at my fertility clinic. My doctor is an endocrinologist, so an endocrinologist or a fertility clinic, or you could ask your OB about finding out a way to get it that way. I just wanted to really stress that because I know I've seen some comments about women who've had a lot of miscarriages, more than me, and I am so sorry. There's nothing I could really say, unfortunately, about how sorry I am, but I truly am. It is a pain that you cannot explain emotionally and physically, and it really sucks, and I'm sorry. But I wanted to keep reading on. I also had the antithrombulin test, and the range is 80 to 120. Mine was 103, so it was a little bit on the higher side, but it was still considered okay. And then I had a whole chromosomal analysis through blood. That's different than your embryo genetic testing like PGT. That's different. So I had a chromosomal analysis done, and they said it was normal. I did come back with 2 set of genes that I had 2 copies of. The first one was C677T and A1298C. Now, I think my doctor said the C677T is more common, like a lot of people have that, so that's not really an issue. But the A1298C, I want to say, is the one that kind of coincides with the anti-cardiolipin antibody, kind of similar thing, like it can lead to a thrombophilia event, you know, stroke, blood clots, stuff like that. But you can look this up and ask your doctor about it in their own discretion and all that. So that test I was just talking about was the MTHFR. A lot of people ask about that test, and that's the one with the copies that I was talking about, and I'm reading from my book. I had to write down all of these tests for y'all. And then I was trying to see if I had any new diagnoses to tell y'all about besides the anti-cardiolipin antibody. Ooh, my hair is curling up. It's raining here, guys, and my dogs had to go use the restroom, so I ran them outside right before I started filming this video, and I had just done my hair because my hair is naturally curly and frizzy, and when I came back in, it was like, oof, it poofed up on me. I'm really waiting to go back in April to find out if I truly have Sjogren's or like what's going on with that. It's an autoimmune disease. It causes dry eye, dry mouth. It can cause vaginal dryness, weak and sore muscles, nerves, joints, all that. So, usually if you have the anti-cardiolipin antibody, you can sometimes have lupus with it. It's more common to have lupus. Excuse me, but I'm having Sjogren's symptoms. And so I went to a rheumatologist, and they're treating me for the symptoms of Sjogren's. But as far as actually having it, I'm not really sure. Like, my test came back negative, but it was like a point from being positive. But my eyes are always, they feel like sandpaper. Like, I put drops in my eyes 4 or 5 times a day. My mouth is always dry. I have had vaginal dryness, and like the first fertility doctor that I went to, that's one of the first things I think I talked to them about. It was in my first year or year and a half into fertility treatments in that world, and she was like, I don't really know why you're having that much vaginal dryness. But so that could be that. But I'm waiting for an appointment in like a month to see the rheumatologist again, and see what else they can tell me about that and the antibody issues. So I just wanted to talk to y'all about that because I know people have been waiting to find out what test I had. So and actually I had some other tests done too. Sorry, I know this video is spaced out everywhere. I haven't filmed in a while. So anyway, I had some more tests for Recurrent Miscarriage Panel. They test your protein C, S, and another S. There's protein S total. Mine was 88. The range is 70 to 140. The protein S free is 50 to 147. Mine was 84. Protein C, the range is 70 to 140. Mine was 124. The prothrombin gene mutation, so they tested me for that as well. That should be something you might consider asking about, and that was negative. Another thing that is super common for people that have recurrent miscarriages is having a factor V Leiden issue, and that's usually like a different type of like blood issue. There's a few types of blood issues, and you can have one and not have all of them, if that makes sense. But that one was normal. And then I had an ANA screen, which is also typical to get for a recurrent miscarriage, and everything was fine on that. And then, of course, they test you for Hep B, C, and that was negative. And then they test you for HIV 1 and 2, and that was negative. So I had quite a lot of testing done. Hopefully we caught everything this time. And yeah, I'm hoping to upload some more videos for y'all soon. I'm filming another video today. So I'm sure you'll see me in my bathroom again. It's brighter in here and it's raining and dark outside. So I'm going to be showing y'all my stim medications next. And so that's what I'm going to be doing and showing you in my box I put together for stimulation to prepare my ovaries up for retrieval, which is taking my eggs out and having them frozen and put with my husband's sperm to make embryos. So that'll be my next video, and then I should have some coming up, hopefully, of me doing the injections sometime next week. And hopefully I'll be able to film some back in the ultrasound rooms and all that. I'll try to get as much as I can that I'm allowed to get. So, yeah, I wanted to give y'all a more lengthier video than I usually do. Thank you guys for watching. If you watch this long, I know I don't have that many viewers, but I really appreciate when y'all watch. I like to get the word out about infertility, recurrent miscarriage loss, PCOS, endometriosis. You know, there's a lot of things that go into infertility and fertility clinics. And yeah, so I just wanted to film a video for you guys, and thank y'all for watching, and y'all have a blessed day. Bye.